My name is Joy Oliano. I'm the nurse case manager for Traurig House. We are on the campus of Gaylord Hospital, and we are Connecticut's only residential program for people with brain injury. We act as a bridge between a rehab setting and going home. So our goal is to transition our folks from Traurig House to home and make that transition as smooth as possible. We are an 8-bed ranch-style home, again on the campus of Gaylord Hospital. We have rehab techs in-house 24 hours a day. We have myself, a nurse case manager, and we also have a director. Our residents during the daytime go up to the outpatient department and they have a full day of therapy. Anyone that has acquired a brain injury would be appropriate for our program, whether that's a traumatic injury, whether they've had a stroke or an anoxic injury. Pretty much any medical event that causes a brain injury would make someone appropriate for our program. Of course, they need to have some restorative potential. They also need to require speech therapy as part of their therapy here. And they also would receive physical and occupational therapy, but speech therapy is really key because that will speak to their cognitive deficits and then any communication disorders they might have. They must be able to tolerate a full day of outpatient therapy. They do have some breaks in between, but they're pretty busy from 8 in the morning till about 4 in the afternoon. The program runs Monday through Friday, and the unique thing about Traurig is that our residents go home on Friday afternoon and return to us on Sunday somewhere between 3 and 9. And the whole goal of that, again, is to gradually transition someone into the home environment. Our average length of stay is about 4 to 6 weeks, but that's highly variable as well. Our goal is to have our residents not only attend outpatient physical, occupational, and speech therapy Monday through Friday, but also to practice living skills in the home. Laundry, meal planning, shopping, things like that. Things that we do at home without even really giving it a thought, but someone needs to relearn that skill before they can go home. We do community out trips on Fridays, so there's a planning meeting for that on Wednesdays, and they'll go to a local coffee shop or restaurant or some kind of local attraction, again, to help people practice their social skills in a safe and supervised environment. So that pretty much is what we do here. Our goal is always to get our residents home with their family, so we do need to have families that are committed to providing 24-hour supervision on the weekends, and then also at time of discharge, and many of our residents don't need that at time of discharge, but just in case, we do need to know that family is committed to provide that.